Welcome once again to another episode of Justice in Scrubs, where we explore the intersection between medicine and the law. I am personal injury attorney Richard Hastings, and I'm joined by my co-host,
Dr. Jeff Michaelis. Hello today.
And today we are going to discuss the 5 leading causes of death in the United States so you can take proactive steps to help make your life longer and healthier. Before we dive in, it's important to remember that the information we provide is for informational purposes only. Every situation is unique, and decisions regarding your health or legal matters should be made after consulting with your own doctor or lawyer. Our aim is to inform and empower, but personal circumstances require personalized advice. We'd like to take a moment to thank our sponsor, findagreatattorney.com. If you or a loved one has been injured in an accident, finding the right lawyer can make all the difference in getting the compensation and support you deserve. That's where findagreatattorney.com comes in. They're a free lawyer referral service that connects accident and injury victims with the best attorneys in their area. With findagreatattorney.com, you can be confident that you're getting a highly qualified and experienced lawyer who will fight for your rights. The best part? Their service is completely free. So you have nothing to lose and everything to gain. If you're in need of legal assistance, head over to findagreatattorney.com and let them help you find one of the best lawyers in your area for your case. So let's start in on the number one leading cause of death in the United States, which is heart disease.
Yes, thank you. I think the best way to describe decreasing heart disease risk is with a story. I started medical school in 1979. I graduated in 1983, and then I did my residency training from 83 till 86. And during that period of time, when I worked in the emergency room, like clockwork, every morning there was 2 or 3 patients come into the emergency room with a heart attack. And then in 1987, statin cholesterol-lowering medications were discovered. And then in the early 1990s, they became widely prescribed. And if you worked in the emergency room in the mid-1990s, hardly any heart attacks came in. A dramatic decrease. And if you look at the statistics, from 1990 to 2019, right before COVID, heart attacks decreased in the United States by 50%. And most of it is due to statin medication. Amazing. Statin medication, cholesterol-lowering medication, has revolutionized heart disease prevention. And now, today, we have another new medication that will further revolutionize heart disease prevention. The medication is called Wegovy, W-E-G-O-V-Y. Wegovy is an injectable medicine that is used once a week that was initially started to help diabetes control of blood sugar. But it was also found to lower weight. It was a great weight-reducing medication. So the combination of reducing weight and maintaining sugars have decreased heart disease risk by 20%. This is the first medication that got FDA approved for heart disease prevention.
So let's talk about, and this I find fascinating because 4 of the 5 leading causes of death have these common maladies within them. So if we want to reduce the risk of heart disease, what do we need to do?
Well, first is you need to see the doctor. Everybody should have a physical after the age of 40, because that's when heart disease becomes prevalent. And if you have high blood pressure or high cholesterol, those are significant risk factors for heart disease. And there are medications for it. As we discussed, there are statin medications. And there's medications for blood pressure. Blood pressure is a leading cause of heart disease because if you have an elevated blood pressure, your heart is pumping against increased pressure, and that makes the heart work harder. So we have great medications these days to decrease high blood pressure, and they have minimal side effects.
So let's talk about managing high blood pressure and managing cholesterol. What dietary or exercise things can we do to help reduce blood pressure and reduce cholesterol?
Right. So to decrease cholesterol, you just have to have a low cholesterol diet. So you don't need to go crazy, but you just need to decrease the amount of cheeses and red meat and high sugar foods. So let's say, for argument's sake, you would decrease the amount of desserts you eat. It would make a huge difference. Maybe instead of eating red meat every day, eat red meat once a week. Or if you're going to have a high cholesterol food, maybe have it less often. Have it for your birthday or celebrations, but don't have it as a general everyday habit. And those simple things can significantly decrease your cholesterol along with the medication.
Mm-hmm. So the next thing that you can do to reduce your risk of heart disease, I find inconceivable, although it's something that's very, very difficult to stop, and that is smoking.
Yes. Smoking actually impacts almost all the other causes of death. And let's talk about that. It's probably the hardest thing that you can do is to stop smoking. And one of the things I tell my patients is the average number of attempts that you ultimately become successful to stop smoking is 6.
Wow.
So if you failed one time, if you failed twice, keep trying, because it's likely that you're going to take at least 6 times to stop smoking.
So fail until you quit.
Fail until you quit is a great line for cigarettes. Also, we have medications now. So if you do want to stop smoking, tell your doctor, and your doctor can help you. They have great medications with minimal side effects. So you can stop smoking. It's difficult, and it might take a while to stop, but if you really want to stop, and you really should stop, we can help you.
Another one is maintaining a healthy weight.
Yes, that's also very, very difficult. But nowadays we have medications. Wegovy is a great medication, can decrease your weight by 20% within 3 to 4 months. So once again, don't be ashamed. If you don't have a healthy weight, ask your doctor. We can help you.
What's the new one? Is that Ozempic?
Ozempic, Wegovy, that's the same class of medication. Mm-hmm. They're injectables, and they really help. And
then another way you can reduce your risk of heart disease is by managing your stress.
Yes. And once again, there are medications for that, or see a therapist. Ask if you're having stress, ask your doctor. We can help you.
But what's interesting is one of the ways that you can manage your stress is to increase the amount of exercise you do.
Yes.
So it's basically a hand in a glove. You're exercising to get into better shape physically, and then you're also kind of reducing the stress that you're experiencing.
Yes. I mean, everybody has their stress reducers. Personally, I use exercise because exercise is a great stress relief. And you don't have to run a marathon. Some brisk walking, 20 to 30 minutes a day, can make a significant improvement. But you got to pick an exercise that you like, because if you don't like it, you're going to do it for a week or two, and then you're going to stop. So everybody has certain things. If you like biking or walking, I mean, walking is a great exercise because you can make it social. You can walk with your friends, and it's not that hard on your joints. So walking is a great start.
So let's talk about some tests that people can take for detecting heart disease.
Yeah. I mean, the most important test is a blood pressure check, because by lowering your blood pressure, now remember, 70% of elderly people over the age of 65 have high blood pressure. 70%.
Wow.
So just having your blood pressure monitored is significant. Having your cholesterol checked, very important. And there are other more sophisticated testing. For instance, there's a CAT scan that looks at the calcium score of your heart. Now, it's very helpful if if the doctor's deciding whether to give you cholesterol medication. If you're right on the borderline, we sometimes use the calcium score to decide. Because if your calcium score is 0, you probably don't need medication for your cholesterol. But if your calcium score is 100, then we're more likely to treat a borderline cholesterol. So it is very helpful.
What about an EKG?
EKG is not helpful. EKG shows heart injury, but only during the injury. So you can have a completely normal EKG and have heart disease. So an EKG is not helpful.
What about an ECG?
Well, it's the same thing, actually. EKG and ECG are the same thing.
So electrocardiogram and an echocardiogram.
An echocardiogram looks at the wall motion. That also is not that helpful. Sometimes we do stress tests on people that are high risk. The problem with stress tests is there's a high false positive rate. So in other words, if you have a test and it's positive, it might not be truly positive. It might be falsely positive, meaning that you have a stress test and you have a normal heart. That will bring us into doing further tests on you that you might not need. So you really should not rush into these tests without talking to your doctor first.
And are there any new tests in the realm of detecting heart disease?
Well, the big new test is the calcium score.
Okay.
It's a simple CAT scan, low radiation. Sometimes the insurance companies do not pay for it, and it's between $150 and $200. But it's very, very helpful, along with the other tests.
So let's now go to the second leading cause of death, which is cancer.
Right. So heart disease and cancer are definitely the most common. The other ones are much less common. So cancer, there's a very interesting new test out there called the Gallery test. The Gallery test is a simple blood test, and it looks at proteins that are, so what happens is all your cells in your body leak a small amount of protein, and the proteins are distinct from different cells. So you can tell if there's abnormal cells out there just by the protein levels. Now this is a new test, and this test is AI, machine learning type of test. So the test is going to get better and better and better as the machines learn more. And it's a remarkable test. It looks at 50 different cancers. What's the most amazing thing is that if it's a positive test, there's a 99.5% chance that there is a cancer there. So it doesn't cause a lot of false positive tests. It doesn't open up a can of worms to having lots of extra tests. It's recommended for people over the age of 50. So like you are over the age of 50, is that true?
Just barely.
So you should have the test. The only problem is the insurance company does not pay for it. And it's about $950, which is a lot of money. So, and it's not indicated if you are pregnant, which you don't need to worry about, or if you are undergoing any cancer treatment. It's not recommended. But it's a great test that you should consider having. Now, you might ask me, if I have a Gallery test, do I still need my colonoscopy, which I really don't want to have, right? Nobody wants to have it. No, the answer is, unfortunately, at the present time, the Gallery test can miss small polyps or small little cancers that are preventable, that can be cured through the colonoscopy. So at the present time, you do need your colonoscopies and your mammograms.
We wanted to take a quick break to remind you about our sponsor, findagreatattorney.com. Dealing with the aftermath of an accident or injury can be overwhelming. And the last thing you want to worry about is finding the right lawyer. Findagreatattorney.com simplifies the process by connecting you with one of the top attorneys in your area who specializes in your specific type of case. Whether you've been injured in a car accident, suffered a slip and fall, or experienced medical malpractice, findagreatattorney.com has a network of experienced lawyers ready to help. And remember, their service is completely free. so you can focus on your recovery without worrying about the cost of legal representation. If you or someone you know needs legal assistance, don't hesitate to visit findagreatattorney.com and let them match you with one of the best lawyers in your area for your needs. So in the list of cancers, my understanding is the leading cause of cancer deaths is lung cancer. And not surprisingly, the number one cause of lung cancer is smoking.
Right. So smokers have a life expectancy is 10 years less than non-smokers.
Amazing.
10 years less. And they're 5 times more likely to develop cancer than a non-smoker, 5 times the amount. And it's not only lung cancer, it's esophageal cancer, stomach cancer, colon cancer, kidney cancer, bladder cancer. So yes, once again, if you smoke, what was it? Fail to quit or something you said before?
Fail until you quit.
Fail until you quit. Just keep trying. You can do it. It's hard, but you can do it. And also don't be afraid to ask your doctor for help.
And then we had talked about this before, and that is colon cancer.
Yes. So after the age of 45, it's recommended that you have a colonoscopy. Now, during, no one really wants to have a colonoscopy, but nobody should be dying of colon cancer anymore. Because if you get your colonoscopies and you follow the schedule, you should not die of colon cancer. I'll tell you a story. One of my favorite patients turned 50. And I told him he should have a colonoscopy. And he said, yeah, I don't want to have a colonoscopy. I don't want someone shoving that thing up my you-know-what. And 3 or 4 years later, he developed colon cancer and died 2 years later.
Oh, my God.
He had the loveliest family, the sweetest wife, the young kids. He did not have to die if he had his colonoscopy. Now, the procedure itself, you don't feel anything because you get medication. The prep is a little difficult. It's a couple of days in your life that you might have to sit on the toilet for a little while. You know what? Just buy a book. Read a book while you're sitting on the toilet. It's worth it. You do not want to have that. One of my favorite patients, he should never have died. And colon cancer is 99% curable if you have your colonoscopies.
So my understanding is that every polyp is not necessarily cancerous, but every cancer must grow inside a polyp.
Correct.
So if they find a polyp and they snip the polyp, they have then hopefully eradicated the risk of getting cancer.
That's very well said, Mr. Lawyer.
Only because I've had a number of colonoscopies. And like you said, nobody wants to have a colonoscopy. To me, there's no real horrible part about it. It's more psychological. For me, the most difficult part is not eating for a whole day.
Right.
But other than that, and after you have it done and the doctor says you're fine, it's like a huge weight off your shoulders. And unlike your friend, God forbid, if you were to skip one of your scheduled colonoscopies and go in several years late and then find out you have colon cancer, I mean, oh my God.
Right. Once colon cancer is outside the colon, it's very, 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 very difficult to treat. Now, there is something called Cologuard, where you probably saw commercials on TV about it, where you actually put your poop in a box and send it off to somebody.
Right.
So that's 93% accurate. Now, 93% sounds fantastic, right?
No, to me, it's 7% inaccurate.
Right. And if you look at 100 people, that's 7. If 100 people are in an audience, 7 people in that audience are going to have cancer that's missed. So 93% is not great at all. It might be great for baseball, or shooting free throws. But with medicine, we need to be about 99 or 99.5% accurate. 93% is not good. So we do Cologuard on occasion of people that don't have that are not medically stable to have colonoscopies. That's the only reason to do it.
In fact, a very good friend of mine, I had asked him because he's around the same age about, how often he goes in. He said, I do the Cologuard thing. I said, you're nuts. To rely upon that as to whether or not you have colon cancer?
Yeah, he's nuts. I'm sorry, but he is nuts.
Let's talk about breast cancer.
Okay. breast cancer, unfortunately, 1 out of every 7 or 8 women in their lifetime are going to have breast cancer.
Wow.
1 out of 7 or 1 out of 8, depends on which study you look at. And I think the best way to discuss breast cancer is let's look at certain patient types, okay? Let's say you would take a 42-year-old woman who has no family history of breast cancer. Should that person have a mammogram? Well, the recommendation for mammograms are 45 or greater. And between 40 and 45, it's up to the individual person. The reason why they say that is because the natural history of breasts are that they actually change. They become more fatty as you get older and less fibrous. So a breast that has more fibrous in it is a thicker breast, and it has more false positives. So you're more likely to have a falsely positive mammogram between the ages of 40 and 45. So if you understand that, you might understand, and you get the phone call from the radiologist that we need to do more tests, or you might need another test in 3 months, or you might even have a biopsy. If you can psychologically handle that, I would recommend at the age of 40, because we're seeing more and more young people with breast cancer.
And what they tell women is that you have dense breasts, which means that I guess they can't accurately detect whether or not you have a cancer, so they want you to go in for the next test. But everybody that hears that news thinks immediately, oh my God.
Right. So what I would recommend is if you're getting a mammogram between the ages of 40 and 45, also ask for an ultrasound. Because sometimes the ultrasound could give us the clues that it's fibrous, it's not cancer. But unfortunately, the ultrasound also doesn't show everything. So you might end up having a biopsy, or they might tell you to have another mammogram in 3 months.
And then I met somebody this past week. I don't know that I had ever heard of this before, a gentleman who had breast cancer.
Yes. So that's a really good point. If a man feels a lump in their breast, don't ignore it.
Right.
Because, unfortunately, breast cancer in men are more difficult to treat and more aggressive.
Which brings us to our next cancer, the cancer you never, ever want to hear that you have, and that is pancreatic cancer.
Yes.
And in most cases, I think that's a lethal diagnosis, is it not?
Yes. Now, I can give you a personal story. My mother died of pancreatic cancer, but she lived for 7 years after her diagnosis, which is unheard of.
Wow.
She was lucky. She ended up having a CAT scan for something else, and they stumbled on this little tumor that was less than 2 centimeters. So she had the surgery, and she did great for like 6 or 7 years. And that's a really important 7 years because she got to see her grandchildren grow up, and our grandchildren really got to know her and how important she was to our family. So that's a story. Now, because I have a family history of breast cancer, my sister keeps asking me, what can we do to know if we have pancreatic cancer? One thing I told my sister is to get the Gallery test, because the Gallery test can give us some hints about pancreatic cancer. And the other thing is, my doctor, when I had a physical 5 or 6 or 7 years ago, recommended I have an MRI. Now, the problem with a full body, some people are having executive physicals and having a full body MRI. The problem is that they always find something, and it's usually nothing. Like the first time I had my MRI, they said my ducts were a little dilated, but they didn't think it was anything, so I needed another test in like 6 months. And, obviously I was a little concerned because my mother died of pancreatic cancer, and that's one of the early signs of pancreatic cancer is your ducts being dilated. But they reassured me that it was okay. So then it became a standing joke. Every time I have an MRI, they find something.
Right.
And it's probably nothing, but...
But we all fixate on the butt part.
Right. And then, but I started getting over it after about 3 or 4 times. It became a standing joke with me and my radiologist. So you just need to understand if you're going to get some of these tests, they might open up some cans of worms, and
of course,
and you might have to deal with that. And if you can't deal with that, like I know you probably couldn't deal with that personally from talking to you, but if you got to realize that you might have a positive test that means nothing.
So getting back to pancreatic cancer, my understanding as to why it is so deadly is that it's an asymptomatic cancer until it gets to the point where it's a real problem. And then you have symptoms. And by the time you experience these symptoms, the cancer is so invasive that...
Yes, because the pancreas is deep inside your body, and it really doesn't touch too much stuff. So, and the pancreas itself doesn't cause pain. It's the surrounding areas of the soft tissue. So when it's in the pancreas itself and it's not touching anything, you don't get pain, especially if it's on the head of the pancreas. So it only starts causing pain when it comes outside the pancreas, and then at that point it's impossible to treat.
So let's talk about prostate cancer.
Right.
And the best way to detect prostate cancer is through a test, which is?
Right. So there's a PSA, prostate-specific antigen. So once again, that PSA is a protein. And all prostate cells, normal prostate cells, leak a little bit of this protein. But prostate cancer cells secrete more of that protein. So if you have an elevated PSA, it's more likely to be prostate cancer. But if you have a large prostate and it's non-cancerous, you can also have an elevated PSA. So the PSA of less than 4 is considered normal, but a PSA above 4 can just be caused by a large prostate, or it could be prostate cancer. So the specific blood test, the one-time blood test, doesn't give us that much information. What gives us most information is a change in the PSA. So let's say, for argument's sake, you have a PSA of 3.5, right? 3.5 is less than 4, but it's borderline. You might want to have another blood test in 3 to 6 months. And if it goes from 3.5 to 5 over that period of time, that's concerning. Now, the PSA can elevate 20% a year just because as men get older, their prostate gets bigger. So 20% of 3.5 is like 7. So it can go from 3.5 to 4.2, but if it goes to 5, that's a concern. And also, prostate cancer typically is a very slow-growing tumor. So you can wait before you don't have to rush into treatment. Now, the PSA, so if you look at the screening recommendations for the National Screening Association, they tell people to stop screening at 74. I think using age alone is a terrible way to determine when you should stop screening. What I did in my practice is I used the 10-year rule, meaning that if I think you're going to live for 10 years, I don't care what age you are. I think you should continue screening, mammograms, colonoscopies, because we have plenty of people that are 75 years old that could live 15, 20 years. And we have people in their late 80s and early 90s that are playing tennis and doing great things out there and taking care of grandchildren and great-grandchildren. And so if I'm healthy, I'm 76, I'm going to continue my screening. I don't use age, but I use the 10-year rule. So let's say you're 62 years old and you have end-stage heart disease, you shouldn't have any screening because you're not going to live 10 years. When we think of screening, we think of 10 years out. So I always use the 10-year rule to determine the age, because screening recommendations are looking at the whole population, the population of the whole, not of the individual patient.
That's a great point.
So you should really discuss with your doctor. Let's say you're a 77-year-old, you're playing doubles tennis and you're doing great things and you're going on vacation, you're taking great grandchildren. Speak to your doctor. I don't think you should stop your screenings.
So let's talk about, and this is kind of a theme, reducing the risk of cancer death. We get back to, again, number 1, quit smoking. Number 2, maintain a healthy weight. So my doctor tells me that 80% of all health challenges that you are experiencing are directly related to your health, to your weight. So if you're overweight, you run the risk of developing all kinds of challenges medically because of your weight. Eat a healthy diet, and again, exercise regularly. So if you make these things a part of your daily routine, you certainly reduce the risk of each one of the 4 leading causes of death that are not accident-related.
Absolutely. And once again, it's tough to stop smoking. It's tough to lose weight. But we have medications that will help you. So don't be afraid to ask your doctor for help, because they can help you. And
I think the best advice you can give in this scenario for all these situations is see your doctor on a regular basis. Get physicals on a regular basis. Go and see a doctor if you're having any problems or if things change or, any of these situations so you can get treated as quickly as possible.
And don't be embarrassed to ask your doctor for help, because they can help you.
So the third leading cause of death, which is the only non-health related cause of death, is unintentional injuries. So the number one cause of death of unintentional injuries is motor vehicle accidents. And I was on the Teen Safe Driving Commission for the Department of Motor Vehicles. And what's important to understand is that most accidents are not accidents. They're caused by drunk driving, speeding, distracted driving, sometimes elderly driving, teen driving, where there are things that you can do to greatly reduce the risk of being involved in an accident. So if you drive under the influence of alcohol or drugs, your risk of being involved in an accident greatly increases. And if you are involved in an accident, again, that's not an accident. You chose to drink, you chose to do drugs, and you operate a motor vehicle. And the same thing with speeding. And, there are many, many things, distracted driving. There are many things that you can do to greatly reduce the risk of your being involved in an accident. Right. And it's so important to keep those in mind.
Do you want to talk about the cell phone and driving?
All of those things. And I know somebody who just got a self-driving car. And that individual will have his Tesla drive him from point A to point B. And it's something that scares me and concerns me, and for other people it doesn't. They use these self-driving cars, but I think, again, it's important to understand that you need to be constantly monitoring what's going on in your self-driving car. Falls is another cause of, a large cause of death. We talked about this in a prior episode about our elderly parents and things that you can do to reduce their fall risk, because if you're elderly and you fall, your whole life can change.
Right.
Instantaneously. Poisoning, drowning, fires. I mean, all of these things they're associated with activities or actions you can take to greatly reduce these risks, not the least of which is always paying attention, always being mindful. Drownings, for example, falls, watching out for what hazards you have around where you're located, putting up lighting, making sure properties are maintained. All of these different things can greatly reduce the risk of dying from an accident, but also about being seriously injured in an accident or, God forbid, causing the death or serious injury of somebody else.
Right. Do you want to talk about elderly safety checks and things like that?
Sure.
It's important when your parents become elderly that they might need a little help, or you might need to go over to their apartment and look at their apartment or their house. Well, I always start with the outside first. Like Richard said, there's a fall risk, especially outside. So you want to make sure their patios or their walkways are level or level, and there's no stones that they might trip over. You need to look at the stairs coming up to the house. Maybe you should have railings on both sides, or lighting. Lighting is huge because elderly people have difficulty seeing, especially at night. So you should have those
motion detectors.
Yeah, and also, the motion detectors are cheap and they're easy to install. Very, very helpful.
And so maybe an important point that you're making is it's almost like you go to your house or your elderly parents' house and you wear the hat of a safety inspector. And you look at your visit through the eyes of a safety inspector. What things are visible that you could change? The motion detectors outside, the motion detector lights inside, things that will allow the elderly to see different types of hazards, if in fact they exist, or to see where the steps are to assist them.
Right. So inside, there's no reason that elderly people should have area rugs, right? Area rugs are dangerous. And also cords, electrical cords all over the place. They trip on these things. Make sure the electrical cords are away from where they're walking.
And something else you had mentioned, which I think is so incredibly smart, is that if you have an elderly parent, there should be no reason for them to have step stools or step ladders, in their house or in their apartment. I mean, that's just a disaster waiting to happen.
Right. And also, they shouldn't be having to go high. Everything should be within reach, simple reach of them in the kitchen, in the bathroom. You don't want them to go high. Absolutely not.
So let's talk now about the fourth leading cause of death, which is chronic respiratory disease.
Right. So most people who die of respiratory disease die of infections. And most of the infections are in patients with underlying respiratory disease. I mean, so one thing that we can do significantly to decrease their risk is vaccinations. Now, I know vaccinations are somewhat controversial these days, but people that have underlying respiratory diseases absolutely need vaccinations. They need a pneumonia shot, they need RSV, and they need COVID shots and flu shots. People with underlying respiratory diseases need COVID vaccines. If you don't have underlying medical diseases, the vaccines are up to you. You make your own decisions. But people that have underlying, especially respiratory diseases, can significantly decrease their risk of dying just by simply getting vaccines.
And my understanding that a large percentage of the COVID deaths were associated with people with underlying respiratory
Absolutely.
diseases.
Nursing home patients, yes. Unfortunately, there were some patients that had no underlying diseases, but the majority of the patients that died of COVID had underlying respiratory diseases, or they were the advanced elderly.
And again, and not surprisingly, the number one thing you can do to reduce the risk of dying from a respiratory disease is to quit smoking.
Yes. Yes. And, we've discussed this now 3 or 4 different times because how important it is. And remember, quit to fail. What's this thing? Fail to quit?
Fail to quit. Fail until you quit.
Fail until you quit. Keep trying.
And you know what's interesting about smoking is I know somebody that's my age, and when their mother was pregnant, they were going through anxiety with the, carrying this child. And they went to the doctor, and the doctor said, you should smoke to reduce your anxiety level. Huh? And this is back in the 50s.
Yeah. Right.
So the doctor was saying that you should smoke because it will help you reduce your risk of anxiety. But, now everything that we know about smoking, if you want to improve your health, in fact, if you want to have your health deteriorate very quickly and certainly open yourself up to all kinds of medical challenges, you should smoke. And if you want to reduce those risks and elongate your life, one of the first things you need to do is to quit smoking.
Right.
Difficult to do, but very, very, very important. Avoid air pollutants. So, if you're in areas, for example, I have underlying respiratory challenges. And if I go into a basement, for example, that's musty or damp, or if there's, if you ever go into a place where there's black mold, my sinuses flare up almost immediately. So you have to be aware of that and then to, make sure that you're not in those different environments. So let's go to the fifth leading cause of death, which is stroke and cerebrovascular disease.
Right. So the pathophysiology of strokes is very similar to heart attacks. Heart attacks are death of the muscles, heart muscle, and strokes are death of the brain cells. And the brain cells and the heart muscles are fed nutrition through the arteries. And the nutrition is oxygen and sugar and things like that. So the reason why these brain cells or heart cells die is because the arteries are blocked. And the arteries are blocked because of high cholesterol, hypertension, cigarettes, diabetes. So it's the same thing. Stop smoking don't eat too much sugar, watch your blood pressure, and watch your cholesterol.
So let's talk about different types of strokes. What is an ischemic stroke?
Ischemic stroke is the brain does not get enough blood because of a blockage in the arteries, and the cells partially die.
And one of the risk factors is high blood pressure.
Well, there are 5 risk factors: diabetes, hypertension, family history, cigarettes, and cholesterol.
And how does AFib affect that?
AFib is an irregular heartbeat that causes the blood to pool in the atrium, part of the heart. And when blood pools, it causes clots because you need the blood to constantly flow to prevent clotting. And when you get clots in the arteries, the clots can break off and then travel into the arteries near the brain and cause a blockage. That's an embolism. And embolic strokes are people with atrial fibrillation have at least a 5 times greater incidence of developing strokes because of embolic strokes. So the treatment for that is blood thinning. So if you're having palpitations or irregular heartbeat or you get short of breath, make sure you see the doctor, because if you have atrial fibrillation, that needs to be treated right away.
And what's a TIA?
The TIA is a transient ischemic attack, which means that the brain gets injured but doesn't die. So your symptoms are transient and they recover totally. So the TIA tells us there's something wrong in the arteries that needs to be treated. So a TIA should be treated the same as a stroke. You need to go to the hospital immediately to prevent any further, because TIAs can then form into a stroke, and strokes are death, and you can have disabilities.
So what are some of the symptoms of a TIA?
Well, I think we should talk about FAST, because the same symptoms of a TIA, the only difference between a TIA and a stroke is a TIA resolves transiently. And so a transient deficit that totally resolves is a TIA. A stroke is a deficit that remains. Now, there's something called FAST, F-A-S-T, which is a great mnemonic for stroke symptoms. F is for face. So let's say your relatives or friends have symptoms that you think they might be a stroke. You should take FAST. F is for face. So ask them to smile. If they smile and it's asymmetrical, one side is higher than the other, that's a symptom of a stroke. A is arm. Tell them to raise both arms. And if one arm goes like this, strokes are usually on one side. So if one side is weaker, that's a concern. And S is speech. So ask them to talk. And if they start mumbling, that's another sign of stroke. And T is time, because it's urgent that if they have any of these symptoms, you go to the hospital immediately and you don't drive them. You call 911 because they can start the treatment in the ambulance. Because what you want to do is you want to decrease the amount of death or injury is to the brain cells. Because once the brain cells die, they're dead.
What is the treatment?
The treatment is blood thinning.
Okay.
And they have, in most ambulances, they have the blood thinning medication to start. So you want it right away because you can reverse. You can turn a pending stroke into a TIA.
Amazing.
By giving blood thinning.
So you do this FAST test, and if the face is asymmetrical and everything else is fine, call 911?
Yes, it doesn't have to be, great point. It doesn't have to be all three. Any of those FAS, any of those things happen, the face, the arm, or the speech, get them to the hospital. They don't need all three. They just need one out of three.
And it's imperative that you don't say, okay, we'll do this again in another hour and see how you're doing. It's 911.
And also, don't drive them, because you want the treatment as soon as possible. Ambulance drivers have the treatment in their ambulances, and get it done. Your family members might say, I don't need to go. I don't need to go to the ambulance. No, I don't care what they say. Call 911, because at time, minutes can make a big difference.
And I think it's important for spouses, especially when their spouse says, "Oh, I don't need to go to the hospital." You can't buy into that. You have to be insistent because, like you said, you could be having brain cells that are dying that will never come back again. Whereas if you call 911, they can start to reverse the process in the ambulance.
Yes.
So
Yes.
this is not something to be treated lightly at all. One of the 3 symptoms of the FAS, your face, your smile, your arms, your slurring of your speech, boom, 911, and you go to the hospital.
I can give you an example. There was one of my friends on LinkedIn posted something that his mother called him and said, "I'm concerned about your dad," right? And she told him the symptoms, and he knew about FAST. And he said to his mother, "Because I knew about FAST, call 911." And I forgot which symptoms he had, but he went by ambulance, and the ambulance medication totally reversed the whole thing.
Oh my God.
So he was so thankful that he was taught about FAST. He posted it on LinkedIn.
So any closing thoughts about what people can be doing, should not be doing?
Right. Like you said, what non-medical things you can do is cigarettes. Cigarettes, you got to stop smoking. We can help you. Don't be embarrassed. Ask your doctor about the smoking. You can do it. You might have to fail a few times to quit, but you can do it. You can do it. Losing weight, maintaining a normal weight. Once again, tough to do, but ask for help because we can help you. Now we have great medications for that. And so don't be, and also get regular physicals because your cholesterol, we can treat your cholesterol with statin medication. Decreases your risk of heart disease by over 50%. And then blood pressure.
So I think my takeaway here is that these are lifestyle changes. So you have to get to the point where you say, I am going to change a number of things about my life moving forward. It's not like you go on a diet and you get to your target weight and then you're like, oh, great, let's go out and celebrate. And you start eating all the things you shouldn't be eating and your weight balloons up again. These are changes that you're going to make for the rest of your life. And as we get older, it's imperative that we make these changes, not the least of which is you stop smoking. You can't be drinking to excess. You have to moderate what you eat and when you eat and how much you eat and exercise on a regular basis. And, I tell lots of friends of mine that don't exercise, the second best thing for me about exercising is your body gets in better shape. The first best thing is it clears your head. Because if you're on the machine and you're running or you're lifting weights, you can't be thinking about all these different things that are upsetting you. You're in the moment and your body is in stress, and it's good stress in that you're exercising, your heart rate is up or your muscles are tense or whatever it is. So, and then again, the other thing is seeing a doctor on a regular basis. Very, very, very important. And having blood tests when you go to see your doctor. So whether it's your PSA or whether it's your cholesterol or whether it's a white blood count, there are many things that your doctor can say or do or prescribe for you that will greatly increase your chances of living a longer and happier life.
Also, you might say, I screwed up my whole life and it's too late. It's not too late. Because the minute you stop smoking, your risk of lung cancer decreases.
Incredible.
The minute you stop it. So, yes, you can't reverse what you did for previously, but going forward, it can help. You don't have to say it's too late. It's never too late.
And the thing I love most about what we do here on this podcast is that I have people that listen to these episodes that say to me, thank you for telling me about X, or thank you for reminding me about Y, because I didn't know about that. And what it is that we do here is we hope to affect just one person, to make changes, to get better, to, avoid being in an accident or avoid having some horrific type of health challenge or to point out things that they should be doing. So we hope that this information, and we know that it is valuable because people tell us that. And we thank people for, giving us the feedback and wanting us to come back here and to share all this information.
Right. Our goal in Justice in Scrubs is to educate our listeners, to empower them to handle medical and legal issues.
And one of the things that I find so fascinating is that every time we do an episode, I learn a great number of things from you, and I use those things in my life and in the lives of my loved ones that I share these things with. And I just want to thank you for the great information that you share with others.
Well, you bring a lot of legal issues that I've never thought of before, especially like you're liable if your children drink too much and they have a car accident. Parents might be liable. You bring up a lot of legal issues, too, that I've never thought of before. Thank you for that.
Thank you. And we look forward to seeing you on the next episode.